Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to all of you joining us here today. This is a very special day here. We are talking about our Gold Neonatal Online Conference 2022. And I tell you, I am very excited today. We are speaking with one of our keynote presenters for our Gold Neonatal Conference here this year. And I'm delighted to be able to introduce to you Madge Buus-Frank, who is going to be speaking with us on June 21st. Now, hold that number in your mind right now, because I'm going to give you all the details in just a moment. The exciting factors are, well, let me tell you, I know you're not going to want to miss this presentation. It's going to be fabulous. I've had an inside scoop already. I've been getting to know Madge just recently. I'm excited every time I have her with me. We've had some really fabulous conversations. But this presentation is going to be free and open access to all of you. And I'm excited to be able to say that and have everybody come in from the neonatology world. But first of all, let's have Madge introduce herself to all of you and tell us a little bit about herself. So Madge, welcome to Gold Neonatal. It's great to have you here today.
Thank you so much, Fiona, for the honor, privilege, and pleasure. I'm delighted to be here, and a bit about myself. My name is Madge. I am a doctorally prepared neonatal nurse practitioner. I have been working in the field for close to 40-ish years. No precise numbers here. I don't want to give it away. And I work both clinically as a neonatal nurse practitioner, but I also work at the Dartmouth Institute for Health Policy and Clinical Practice, where I'm an implementation and improvement scientist. And I'm passionate about trying to make health and healthcare better.
I love that so much. Thank you so much. Well, again, a warm welcome to Gold Neonatal. And let's just talk a little bit about some of the other aspects that I know you've had an expansive career. We don't mention numbers here, right? But tell me a little bit about your journey to get there. I'm always so curious to hear, how you got here and the why, what keeps you here in the neonatology field.
Well, the short story is I had a cat who gave premature birth to kittens. And I was fascinated by these little premature kittens, and I tried rearing them with an eyedropper and a timer in the oven door. And fast forward to early work as a nurse's aide and a candy striper, fast forward to an associate degree from the University of South Dakota, where I got my first and most important credentials, those two letters RN, the ones that I'm most proud of forever. Fast forward to one of the early neonatal nurse practitioner programs, began in Sioux Falls, South Dakota, believe it or not. And I was in the second or third graduating class. So that's where I became an advanced practice nurse and learned about deeper anatomy and physiology and neonatal transport and all of the advanced procedures. And then fast forward to a move to the East Coast, where I got my bachelor's degree from the University of Pennsylvania, and fast forward to a recruitment call from Dartmouth. They were looking to build advanced practice nurses and to build a NICU around them. And they asked me to come up for a visit. And I would say nearly 30 years later, I'm still here. And now my blood runs green with loyalty to this organization. During that time, they supported me to go back and get a master's degree from Boston College and ultimately a doctorate, a clinical practice doctorate from the University of Connecticut. And along the way, I've had other sort of avenues to my career. I've been a consultant, so I visited over 100 NICUs around the world. I worked as the executive vice president for the Vermont Oxford Network. I worked in close partnership with the National Association of Neonatal Nurses to launch their journal, Advances in Neonatal Care, but always coming back to the babies and to the things that we're most passionate about.
That's beautiful. And so here we are, an educator and just a lover of all things neonatal, and inspirational too. It would be amiss if we didn't mention your Lifetime Achievement Award that you received in 2021. Tell folks who gave you that award and what did it mean to you?
I'm not really clear why I got the award. I'm always looking around at people who have invested longer and more and done, are far more accomplished. So I am really humbled by the award. But it was a recognition from the National Association of Neonatal Nurses. And I think the real secret sauce to getting this award is that I've always surrounded myself with a team of others who are passionate, motivated, and sometimes smarter and work harder than I do. And so I'm pleased to accept the award on behalf of all the people who have mentored me along the way.
Oh, that's beautiful and so humble of you, Madge. I know that I'm sure the folks around you would feel equally so about you yourself. You're a very, very accomplished person in the field. So thank you so much. And it's lovely to see that. It's great to honor folks like you. And yes, the National Association of Neonatal Nurses, I think definitely got it right. So that's wonderful. All right, let's dive into what's happening here at Gold Neonatal, because we're getting ready and excited for all of that coming up here. So June 21st was the date that I need you to mark on your calendar. And the website you need to go to is goldneonatal.com. You can head over there right now and register for this event with Madge. She's going to be here with us live on that day. And the registration is free to everybody. And we want you to know, we want you to share it with your colleagues. We want you to share this far and wide because we have a feeling that you're really going to appreciate it. The coming together, the understanding, the knowledge that Madge is going to be passing along. But I'll let her tell you a little bit about this particular topic that she's sharing with you, titled Fast Forward to the Future, Reimagining Care in the NICU. Madge, tell us a little bit about what you're going to be sharing with us on the day.
Well, Fiona, excuse me, I think that I'm going to be sharing a little bit of historical perspective. How did we get here? I'm going to be trying to look to concepts and practice models and ways of caring for mothers and babies and fathers in the future that might be different than they are today. And so I'm just going to challenge my colleagues with some thoughts about models of care, how we co-produce care, how we do so in deep partnership with each other and in deep respect with families, and think about some tools, techniques, tips, and tricks to do it more efficiently, more effectively, and to provide both better care to patients and families, but also better care to ourselves and the teams who are in this for the long haul.
Boy, just listening to your words right now, they really resonate with me. That word challenge, I always feel like, yes, I'm up for the challenge, but there are many days that it's really hard to feel inspired, in our work life, in our professional life, with so many things that have happened over the last few years. Madge, I'm sure you hear a lot of this, and now I'm curious now, how have you kept yourself invigorated and thought-provoking and thoughtful about this sort of field?
I have my days too, believe me. It's hard to get out of bed and brush your teeth and strap into the car and get there. But I think what often invigorates me is just really valuing what matters most to our patients. The other day, I had a mother of Muslim descent. She had a very, very sick baby. She was at the bedside peering into the incubator and trembling. And I had no idea which of the 100 things she could worry about she was worried about. So I just asked her, what's on your mind? What's your biggest worry? And then I was there and listened. And by the end of that dialogue, I learned a lot about what matters most to her. And one of the things that mattered is that her baby was 3 days old and she hadn't done the welcoming ceremony that would traditionally happen in their culture. And she didn't know to ask. She didn't think it was possible. And I was able to, just by asking what matters and the bedside nurse and I listening, we were able to huddle and say, we think we can make that happen for you. And what do we need to do? So she taught us about the ceremony, what it meant to their family, how they wanted to conduct it. And the nurse, the therapist, the charge nurse just made the magic happen. And by the time the sun set, we were able to both help that mother's well-being, but we believe we also helped the baby and the father as well. So those are the kinds of moments in our practice that we need to come together and learn from, to cherish, and to make that kind of care the standard, not the exception, but the rule for every baby and every family.
Wow. That was very touching. I have to say, I've got tears in my eyes now, but you're so right. I think that, that listening part, you could have just kept going. You could have just walked by. You could have just said, it's okay. You could have said a multitude of things in that moment, Madge. But the fact that you asked, what's on your mind. You didn't even lead into the question to sort of direct or anything like that. You were just willing to be there and be present. That's pretty special. Well, and I think for many of us, it's become harder and harder sometimes to stop and pause. And I think that's what I heard you saying, is that you paused in that moment and you gave space.
It's also a methodology, and it's why I'm so excited about quality improvement and co-production, because we learn simple things along the way. We learn to ask the question, what matters most to the family, and asking the nurse at the end of the shift, what mattered most to you? I was so grateful for her partnership. She could have said, no way, I've got 2 other patients. We're getting triplets. There's an admission. I mean, there were also many reasons, but what mattered to her as well was to do the right thing for the patient and the family. So it's more than just the humanity. There's actually a science behind the science of co-production and experience-based co-design and really simple tools and tricks. I hope to share a few with all of you that might be helpful to reinvigorate you and your practice and to inspire others in your unit to do our best to raise the bar every day.
Oh, well, thank you so much. Well, I'm truly, I can't wait until the day. June 21st is going to be here before we know it. And for all of you listening now, who perhaps you're saying, oh my goodness, I'm going to be busy. I'm going to be away. I've got things happening. Do not worry. We're going to record this event just for you, and we'll make it available to you, but you do need to register. So go to the website right now at goldneonatal.com. You can register for this free event happening with Madge Buus-Frank, who is going to be with us talking about Fast Forward to the Future, Reimagining Care in the NICU. Thank you once again, Madge, for being with us here today. It's just been fabulous listening to you.
My privilege. I look forward to gathering with all of you virtually or synchronously or asynchronously, and we'll do our best to connect and belong together.
Absolutely. And thank you so much again to our viewers who tuned in today. Thank you for joining us. We'll look forward to having you back here very soon. Have a wonderful rest of your day. Bye-bye for now, everyone.